Hello, I'm Brooks with Medical Restoration Centers. I'm going to be talking to you a little bit today about our programs, how they work, the science behind them, and what we mean by customized program. So the first thing that we do on any of our programs is we find out what your lean mass is. The way we can do that is with this Class II medical device that's FDA approved that basically measures impedance in the body. What that means is it's going to send a little pulse through the body and it detects the density of different masses. So it can tell us where water is, fat mass, and lean mass. When we talk about lean mass, keep in mind that's not just muscle. A lot of people focus on that. We want you to understand that lean mass is everything that's not fat. That's bone, organs, everything else. That's why it's so important to monitor something like that. And we monitor it for all our patients while they're on any of our programs. So once we get that result, we get a printout that looks a lot like this, and this tells us the body fat percentage, this tells us that lean mass amount that we talked about, and your fat mass, so we can make a safe goal decision with you on how much weight you can lose and what that goal weight might be. So once we get that number, we go ahead and plug it into something that we've created. We call it our nutrition calculator. And what this does is this doesn't focus on calorie counting. It doesn't focus on, you know, even really carb counting to a T. What it focuses on is making sure that you're getting the right balance of all macronutrients in order to maximize weight loss, but not lose lean mass and keep your energy levels up. So that's why we're able to customize it not only based on lean mass to make sure you're fueled properly, but we allow our patients to be as active as they want or not active at all. So when you look at this, essentially the counselor, once we do this, this body composition analysis with the scanner I just showed you, we'll know exactly what your lean mass, fat mass, and body fat percentage is. Then we can go ahead and plug a goal in and see what your body fat percentage would be after you're done with the program. So we can kind of see if that's a safe goal to have, or if we need to make it more weight that we're going to lose or less, depending on your goal and what we recommend. Then you're going to look at the very bottom here, and this is really the coolest part of this calculator, is it tells us exactly how many meals you're going to have on our program. We recommend that you use our foods for at least, you know, three meals a day, usually for most patients, depending on what their intake's required. And then it also shows you your protein servings, vegetables, and then how many vitamins. You know, if we need to give you a little bit more of your basic minerals. And the reason we do that is because when you're on a diet like this, it's called a ketogenic diet, or being in a state of ketosis, which is 100% natural, where we use fat as fuel. When we do that, we excrete more of our electrolytes, you know, our micronutrients, if you will, and that would be sodium, magnesium, and potassium. So when that happens, we often need to make sure that we're replenishing that a little bit, not to mention we're taking a few foods out of your diet that we're used to getting a lot of our sodium, magnesium, and potassium from. Though our foods are very healthy, they have some of these things, most patients still need to add it into their diet in some way. That's why we offer the supplements. So now I'm going to show you the next step, and that is once we have the nutrition calculator, we have that data, what we do is we sit down with you and go over your nutrition guide. This is going to be your daily guide throughout the program. So as you can see here, it's kind of blank. We've got these servings, question marks for the vegetable column, which is most important, because one of the things we're trying to do is teach you how to have a healthy lifestyle when you're done with the program from the very first day. We're not here to get you to lose weight and just focus on that and then later try to play catch up with teaching you habits when you're going and basically the world is your grocery store again. So this tells us exactly how many servings of vegetables you should have overall. We've actually used the U.S. Department of Agriculture's database online, and we've compared all the vegetable servings, everything's raw, as well as the protein to know, you know, how much you're going to get from this vegetable versus that. So we put them into tiers. For example, patients can have carrots on our program, but a quarter cup gives you as many carbohydrates and about the same amount of fiber as you would get from a full cup of cucumbers. So that's why they're different tiers, but they both count as one serving for that amount. So this really allows our patients to have more options on the program. Next, you'll see this protein column, and this just shows you that we want you to use our foods because it just makes it easier. We carry 75 different products just like these. We've got anything from hot chocolates to protein noodles. We've got bars, plenty of bars to choose from, soups, fruit drinks. we try to carry as much as we can to allow patients to have better choices and make sure they don't meal skip, because it's one of the worst things that we can do. So once we have that all taken care of, that nutrition calculator actually takes into account what you're getting from our packs on the program. And then it tells you how many servings of protein you need to have by yourself. So if this is going to be, maybe 6 ounces or 6 ounces of chicken versus 7 ounces of duck, which, some people like to have duck. So it's pretty nice to know that even though you feel like you might be on a diet, you have a wide variety of different protein sources and vegetables. And then the last thing you're going to see here is healthy fats. We need to get some healthy fats, and we do. We are not a high protein or high fat diet. Once again, we look at the balance of all 3 macronutrients to make sure that you can lose weight safely and effectively. So we need to supplement some of those calories we're going to get with some added fats throughout the day. And we have a few options down here that show you what you can choose from, so it's not super limited. You're not going to have the same thing all day, like extra virgin olive oil, which is a great healthy fat, but you have more choices than that. Then you're going to see, obviously, that here's the supplements that we usually recommend. This might change. This might go higher or lower depending on the patient and what their requirements are. You can still have your coffee. A lot of people, would be very unhappy if they weren't allowed to have their coffee on any program. So we offer that. And then you can see there's a line here that talks about some of your daily requirements. We talked about sodium and needing to increase that a little bit. It's not a huge amount of sodium, but essentially because we're in a state of ketosis, it's a somewhat of a dehydrated state, because as you're breaking down those ketones from your fat, it creates kind of a extra level of dehydration, and that sodium helps you retain that moisture. And then, of course, we want you to drink a lot of water, 64 ounces or more. If possible, we would like them to drink more. That can help with the weight loss as well. So that's essentially what the day-to-day program is like. It's 5 stages. I just showed you the first stage, and that's only 2 weeks long. It's a little bit more strict than stage 2, where we allow you to have a few other food groups. Once we know you're in a good state of ketosis and you're following the program okay, you feel good, energy levels are good, and all those things are basically checked off. Now, I talk about 5 stages. I also mentioned that from the very beginning, we're looking at, when you finish the program, we want you to have a healthy lifestyle, really without even thinking about it. We don't calorie count, we don't carb count, and we're not saying those are terrible things to do, but we believe in a more behavioral nutrition approach. So what that means is we're trying to get you to be able to see an item at a restaurant, at the grocery store, and understand what that's going to do when you consume it. Is it part of your starchy carbohydrates? Is it a good green vegetable carbohydrate? And so on and so on. So the way that we do that is we have what's called the MRC Daily Plate. And what this does, very similar to the program, we plug in your lean mass and your current weight. Once you're at this level, you've reached your goal, and then we enter an activity level from a scale of 1 to 5. 1 being not active at all, 5 being very active, working out probably multiple times a day, every day. Once we enter that information, this plate goes ahead and calculates itself. It creates this plate that just looks like that. And that'll tell you how much protein, vegetables, carbohydrates, and fats you need. Now, I said vegetables and carbohydrates separately, if you notice, and that reason is because the body needs more carbohydrates from vegetables than all the other sources we normally put in it. So when we put you on the program and you're having these increased vegetables, we're actually thinking about this stage already, once again, because by eating these types of carbohydrates more, it allows the body more time to use that glucose once it's been metabolized, versus some of the starchy carbs that are they just metabolize so quickly that a lot of the time a majority of it ends up getting stored as fat. And that's a big, that's a big attributing factor to why obesity is such a problem. So this really helps with lifestyle. Once again, we don't like to use the term maintenance, because it implies that we're just trying to maintain something, hold on to it after you've achieved it. What we like to think is that we're actually changing your behaviors and your lifestyle overall, so you don't really have to think about it anymore. So after we get your daily plate, you can look at, we've got 3 different plates here that break up your daily meals essentially, and it breaks them up evenly. You can see there's these red bars here. What that is we didn't enter a time. What we do is we actually put times in here, and that tells tells us, you know, how much time you have in between meals. On the program and during the lifestyle stage, we don't want you to have too much time in between meals, because what happens is our body goes into starvation and then it stores as much as it can the next time you eat. So what we'll do if you do have that large of a gap in between meals is we'll add a meal down here, our little snack, preferably a majority protein, but it doesn't have to be all protein. And then you'll add some, maybe, hopefully a balanced meal of all your food groups, protein, fat, and carbohydrates. And then we'll add that down here, and it'll subtract it from the other plate, so you're not getting too much of anything. So in a nutshell, that's essentially how the programs work, how they're customized and why they work. Most patients on our program lose anywhere between 2 and 6 pounds a week. For females, it's about 2 to 3 pounds, and for males, it's about 4 to 6 pounds a week. The last thing I really want to touch on is we don't count calories and carbohydrates. So when I talk about that weight that's lost on average for our patients, I often get asked the question, oh, well, how can you drop somebody to 800, 900 calories or something of that nature? Well, the reason that it's dropped to that amount is the categories in which we lower it. For example, you know, fat, protein, and carbs all across the board. And when we do that, and you're basically breaking down that fat as fuel, that's supplemental fuel or glucose that we're getting, that we're consuming. A lot of people don't understand that when we lose fat, we actually use it, we break it down, the body has to. So once that's done, 2 pounds a week, for example, for a female, that comes out to about 1,000 calories a day that they're burning from their fat. So if I lower a female to that 800 calories with the correct balance, then she's actually consuming about 1,800 calories a day. So that's very, very significant to understand on our program. We offer free information sessions, so if I didn't cover something that is just sitting in the back of your mind that you'd like to ask us, you can always call us at 719-510-6313. Ask your question over the phone, or you can come in for a free 30-minute info session where we sit one-on-one with you, answer any questions you have, and see how our programs might be able to help you. Thank you very much for your time today, and I hope this was a very informational video.